May I invite Ms. Shobana Singham, Manager in Public Relations and Call Center, to have your introduction on MHTC. Please join me. Welcome.
Okay, don't be deceived with this white coat. I'm not a medical doctor. Okay, I'm just going to give you an introduction on Malaysia healthcare as a whole. Okay. My name is Shobana, okay, as what Kratia has said earlier, and I represent the Malaysia Healthcare Travel Council, an establishment under the Ministry of Health Malaysia. Okay, and the Minister for the Ministry of Health is the Honourable Datuk Sri Dr. S. Subramaniam. Malaysia, it's less than 2 hours of flight. So, but most of you know Malaysia for travel, for tourism. Okay. Previously, it was all by word of mouth. Not much advertisement done, not like our neighboring countries, our competitors, Thailand, way back in 2009, 2010. Okay. Did you know that Malaysia, we have a very good healthcare system for our own people? And now we want to got about 149 public hospitals, 268 private. We have a two-tier referral system. Most of us go to the clinics, a committee to stringently select hospitals that can actually serve. We have acts and regulations in place, such as the private healthcare facilities and services, strict advertisement guidelines to follow. In our countries, even doctors that advertise themselves sell all over. Okay. We're very also, we emphasize on quality medical care and the specialists that we have in our hospitals. Served at least 8 to 12 years in the public sector, so they come with a lot of experience. XLIF spine surgery by Ramsay Sime Darby Healthcare, Asia as well. Southeast Asia's first to use the variant triology system for radiation therapy, that is by NCI Hospital in Malaysia. World's first to perform the arm and heart transplant, another one of our hospitals in Malaysia. And Ramsay Sime Darby Healthcare was rewarded 14 International Dental Center of the Year for 2014 and International Travel Quality Alliance Award for the World's Best Hospital 2013. Hospitals, the structure, okay, behind this structure we always serve quality medical care and the facility reputed. You can see on the left, the extreme top, this is where Dr. Apasamy and Cambodians are in the field of orthopedic, fertility, cancer, angioplasty and heart bypass, neurosurgery, dental, cosmetic and cataract surgery. Okay. Social media. And you can also do free Skype calls. Okay. If you go to our website, there's a link there. You can.
Singapore, the quality of the facilities and the quality of the doctors is extremely good in Malaysia. The number two thing that really struck me was the fact that Malaysia, cost of healthcare and cost of living today is very much in line with Thailand, or for me creates an extremely good value proposition. Which is already 30 years in Malaysia. It started with its flagship hospital, Sumanjaya Medical Center. Today we have 3 hospitals in Malaysia, mainly in Klang Valley in Kuala Lumpur. Now, as part of this particular joint venture, we have 3 additional hospitals in Indonesia, 2 in Jakarta and 1 in Surabaya. See BMW, if you see Ford, these are pretty much the brands that Sime Darby held under its realm.
Not only that, the recovery from the surgical incision or the approach was more painful than the real spine problem.
ហើយពេលខ្លះនោះគឺថាការវះកាត់បែបនេះដែលមានការបើកកង្កត់ខ្លួននេះវាអាចធ្វើឲ្យអ្នកជំងឺគឺថាមានការឈឺចាប់ចំខ្លាំងជាងទៅបញ្ហាកង្កត់តទៅវិញ
For example, if the patient comes with a back problem, we have a huge incision with lots of muscle damage just to address the spine problem. ឧទាហរណ៍ថា years ago, we were quite fortunate to be pioneers in this technique in our region.
ជាទូទៅ5ឆ្នាំកន្លងមកគឺថាយើងមានសំណាងដោយសារយើងបានចាប់ផ្ដើមនៅបច្ចេកវិទ្យាវះកាត់មួយដែលគេហៅថា XLIF.
Whereas the XLIF approach, it's from the side.
ហើយចំណែកបច្ចេកវិទ្យា XLIF គឺយើងធ្វើតាមរយៈពីជំនាញឬក៏ចង្កេះនេះទៅ
Headed off to US since the year 2010 to learn this technique. Just do it.
គឺយើងមកមកលេវិញហើយយើងថាទៅវា
Now, please don't. Our surgical rate is about 5%.
ហើយជាទូទៅការវះកាត់
Pain medications, physiotherapy, and rest.
ហើយជាទូទៅការព្យាបាលជាបឋមគឺយើងព្យាបាលដោយប្រើថ្នាំហើយនៅphysiotherapy ហើយបន្តហើយនឹងការសម្រាប់ពីការត្រូវព្យាបាលយ៉ាងម៉េច
These words might mean alien to you, but in simple terms, instability means the spine is not stable. This disease is like a slip disc. Facet is some. This is a model of a. This is the spine. The nerve runs here, and the facet joints are the back. So the whole thing is one complex.
បាទនេះគឺខ្ញុំបង្ហាញតើតងថាមានបញ្ហាមួយគឺតើតងចង្កងខ្នងគឺក៏វាអាចតើតងគេហៅថាវាអាចជាធ្វើឲ្យមានការលៀនចេញបាទហើយគាត់បានបង្ហាញអំពីសំណុំនៃអ្វីដែលមាននៅក្នុងឆ្អឹងកងខ្នងនោះគឺថាវាអាចមានសរសៃប្រសាទនៅជិតនឹងផងដែរហើយក៏វាមានថាសដែលនៅចន្លោះពីឆ្អឹងកងខ្នងមួយទៅឆ្អឹងកងខ្នងមួយហើយក៏វាមានសាច់ក្នុងលើជំនុំហើយក៏វាមានសរសៃពោះមួយទៀតបាទ
If the disc, or I call it a cushion, is damaged, there's more stress on the facet joints, and that is what is known as facet disease.
Hi, boss.
From Prekosma Hospital. I'm internal medicine. So, thank you for your important presentation. And just want to know because I see all the presentation, all the fusion of the new technology focus on the lumbar spine. I just want to know because I see in my practice many patients have the problem of cervical spine pain or cervical spine with the disc bulge or area and also the instability of cervical spine. Just want to know if this new technology can do also with the cervical spine. And related to your proposition, I think the important thing before refer the patient to your hospital, the most important is to know about the price of the operation. Thank you.
Look at me only.
First of all, I will thank the Kingdom of Cambodia for this moment and Dr. Serat for making this event possible.
ហើយជាបឋមខ្ញុំសូមអរគុណចំពោះកម្មវិធីនេះហើយដែលបានមកដល់ប្រជាជាតិកម្ពុជា
My name is Apasami Velu. I represent a team of 4 spine surgeons from Ara Damansara Medical Center, Malaysia.
ហើយខ្ញុំគឺជាគ្រូពេទ្យឯកទេសផ្នែកជំងឺឆ្អឹងកងខ្នងហើយខ្ញុំតំណាងមកពីមន្ទីរពេទ្យដែលនៅក្នុងចង្កោមមន្ទីរពេទ្យរ៉ាមសៃសាំដាប៊ីហើយស្គាល់ចង់ដឹងពីគោលបំណងជំរុញអ្វីដែលគាត់មកបើកកម្មវិធីនៅកម្ពុជាយើងនេះបាទ What is the purpose of your presentation here in Cambodia?
I have 2 purposes in Cambodia. The first one is the love of Lord Buddha.
ហើយខ្ញុំមានបំណងពីរទី1គឺខ្ញុំជាអ្នកចូលចិត្តនឹងស្រឡាញ់ព្រះពុទ្ធ
I'm fascinated by his teachings and his way of life.
ហើយខ្ញុំមានការចាប់អារម្មណ៍និងពេញចិត្តតាក់ទងទៅនឹងការបង្ហាត់បង្រៀនតាមទ្រឹស្ដីរបស់ព្រះពុទ្ធ
Number 2 is to share our passion of spine surgery and its results with the Cambodian people.
ហើយគោលបំណងទី2គឺដើម្បីបង្ហាញនៅបច្ចេកវិទ្យាវះកាត់ឆ្អឹងកខ្នងបើកមុខតូចដែលផ្ដល់លទ្ធផលល្អជូនដល់ប្រជាជនកម្ពុជា
ក គាត់យល់យ៉ាងណាដែរនៅពេលដែលនាំយកនៅបច្ចេកវិទ្យាមកបង្ហាញនៅកម្ពុជានេះតើគាត់យល់ឃើញថាកម្ពុជាយ៉ាងម៉េចស្ថិតនៅក្នុងកម្រិតណានៃសមត្ថភាពសូជាវិញគាត់ថាពេលគាត់នាំមកបង្ហាញនៅកម្ពុជាអញ្ចឹងពីបានផ្ដល់អត្ថប្រយោជន៍អីខ្លះដល់ដុកទ័រកម្ពុជានិងអត្ថប្រយោជន៍អីខ្លះដល់ពួកគាត់វិញ
What do you think are the benefit for the Cambodian people and doctor, and also what benefit you expect from this?
The benefit I get from here is satisfaction of seeing the patient, not just Cambodian people, any human being, to be able to give such great results. They're able to get back to where they are before the pain subside, before the pain existed. They're able to feed their families.
គឺថាសម្រាប់ខ្ញុំគឺថាបំណងគឺខ្ញុំចង់ថាជួយដល់ប្រជាជនកម្ពុជាដើម្បីឲ្យគាត់ឧបមាថាពេលដែលគាត់មានបញ្ហាទៅគឺបន្ទាប់ពីទទួលការព្យាបាលឬវះកាត់ហើយគាត់អាចមានសុខភាពប្រសើរឡើងវិញអាចចិញ្ចឹមឬក៏គ្រប់គ្រងគ្រួសាររបស់គាត់តាមធម្មតាឡើងវិញ
The main aim is for them to get back to where they were before the problem happened so they can continue their normal lifestyle.
គឺធ្វើយ៉ាងម៉េចឲ្យគាត់អាចវិលត្រឡប់ទៅរកជីវភាពដូចធម្មតាវិញមុនពេលដែលគាត់មានបញ្ហាឈឺចង្ខ្នងនោះបាទ
យើងមួយទៀតថាតើចាស់គាត់នាំយកមកបង្ហាញអំពីដុកទ័រកម្ពុជាអញ្ចឹងយើងចង់ដឹង
តែដុកទ័រទេគឺមានក្រុមហ៊ុនផ្សេងហើយមានអ្នកជំងឺអីដែរចូលរួមហ្នឹងណា
ឥឡូវដោយសារតែខ្ញុំអត់ទាន់យល់កម្មវិធីច្បាស់សូមគាត់រៀបរាប់មកថាគាត់មកហ្នឹងគាត់ក្នុងគោលបំណងអីគាត់ធ្វើអីដើម្បីអីណាឥឡូវគាត់រៀបរាប់មកណាដើម្បីមិនចាញ់ខ្ញុំសួរសំណួរតាមក្រោយវិញអូខេគាត់រៀបរាប់មើលថាគាត់មកកម្ពុជាដើម្បីអីធ្វើដើម្បីអីហើយនៅស្រុកគាត់នេះបច្ចេកវិទ្យាមកមិនគាត់និយាយហ្មងណា
So please describe in detail about the main purpose of the visit.
To share our techniques of the procedure and its excellent results to the people of Cambodia.
គឺយើងមកដើម្បីចែករំលែកនៅបច្ចេកវិទ្យានិងវិធីនៃការវះកាត់នឹងហើយនឹងដើម្បីចែករំលែកឲ្យបាននៅលទ្ធផលដ៏ល្អសម្រាប់ប្រជាជនកម្ពុជានៅពេលដែលគេធ្វើការវះកាត់ឬក៏ព្យាបាលតាមបច្ចេកវិទ្យានេះនៅពេលដែលចាំបាច់
And number 2 to see the sunrise and sunset at Angkor Wat.
ហើយទី2គឺខ្ញុំក៏មកនេះចង់ឃើញអង្គរវត្តហើយនឹងតាក់ទងទៅនឹងគេហៅថាពេលអាទិត្យរះនឹងលិចនៅទីនោះផងដែរប៉ុណ្ណឹង